Okay, I'm back. We're going to continue on now with the respiratory system, and the next topic we're going to talk about are respiratory volumes. And you guys might actually get to do some laboratory work with respiratory volumes using a technique called spirometry. And you no doubt will have some experience with measuring respiratory volumes with the patients that you work with in the future as well, because these different respiratory volumes that we're going to be talking about can differ in different patients depending on whether or not they have some sort of respiratory condition that's causing them a problem. Okay, so what are some of these different respiratory volumes that we're going to talk about? What are we talking about here? Well, first of all, you guys know that there is a certain volume of air within your lungs, the total volume, and we'll be talking about that shortly as well. But the first volume I want you guys to think about is called the tidal volume, abbreviated as TV. And in an average adult male, this is about 500 milliliters. It's also about 500 milliliters of air in an average adult female. So that's about 1/4 of a 2-liter bottle of Coke. So that's what 500 milliliters is, because 2 liters equals 2,000 milliliters. That's the amount of air. Tidal volume is the amount of air during a normal inhale, normal exhale. Under normal conditions, you breathe in about 500 milliliters, you exhale out about 500 milliliters. All right, then there's another volume called the inspiratory reserve volume, or IRV. And notice there's pretty big difference there between males and females. 3,100 milliliters in males, 1,900 in females. That's the amount of air after you do a normal inhale and you suck in as much air as you possibly can. That volume is your IRV, or inspiratory reserve volume. So big difference there between males and females. Expiratory reserve volume, ERV. Okay, so if you do a normal exhale and then you force out as much air from your lungs as you can, that is your expiratory reserve volume, or ERV. And that's about 1,200 milliliters in a male, 700 in a female. Okay, now you cannot blow all of the air out of your lungs. If you could, the lungs would collapse. So you always have some air that remains in your lungs, and that's called the residual volume. That's about 1,200 milliliters in a typical male adult and 1,100 in a female. Okay, now let's talk about respiratory capacities. So this is not about the amount of air you're inhaling or exhaling. These refer to the amount of air present in your lungs at certain times. Okay, so your total lung capacity, or your TLC, that refers to the maximum amount of air that can be present in your lungs. And that's going to occur after you make a maximum inspiratory effort. So the deepest inhale possible. That's what that refers to. And that is 6,000 milliliters in a male and about 4,200 milliliters in a female. And that can actually be calculated if you know your tidal volume, your inspiratory reserve volume, if you've measured that, your expiratory reserve volume, and your residual volume in the lungs. If you put all of those things together, that gives you your total lung capacity. Which that makes sense, okay, because you think about it. All right, if you're starting after a normal exhale, you haven't pushed out the ERV, you can't push out the residual volume, so they're still there after a normal exhale. Then you do a normal inhale, that's adding some air. Then you do, that's your tidal volume that's being added in. And then you add in the air from a maximum inhale, that's your inspiratory reserve volume. At that point, you have filled your lungs to capacity. That is as much air as they can possibly contain. So that's why you can determine that value if you know these values. Okay, VC, your vital capacity. This is referring to the changes in air volume that can actually happen, you can never get rid of your residual volume. So your vital capacity is your tidal volume, your inspiratory reserve volume, and your expiratory reserve volume. So it's the amount of air that you can actually get rid of, exhale out with a forcible exhalation, the maximum amount, vital capacity. Then you have your inspiratory capacity. That's the amount of air that you can breathe in, inspire, after a normal expiration. So vital capacity is how much air can you take in after a maximum exhalation. You blow all the air out of your lungs and then inhale. Inspiratory capacity is the maximum after just a normal round of inhaling and exhaling. Your functional residual capacity, so under normal circumstances, the air that's left over in your lungs, normally, not when you're forcibly exhaling, that's called your functional residual capacity, or FRC, and that's your expiratory reserve volume plus your reserve volume. No, plus your residual volume. I'm sorry, I'm getting my R words mixed up there. That's called your functional residual capacity. Okay, so all of those things can be measured by taking measurements with an instrument that looks like this, and you've no doubt probably seen people using these in hospitals. This is called a spirometer, which can be used to measure respiratory volumes. And we do have these in the lab, and we may wind up getting to, or you may wind up getting to play around with them in your class. So here's a graphic representation of the changes. For example, here's a normal tidal volume, up and down, up and down. You're taking in air, you're exhaling it out. You're taking in air, you're exhaling it out. Here's a maximum inhale followed by a maximum exhale. And so you can see where these volume terms come from. So again, a spirometer is an instrument that's used to measure these respiratory volumes and capacities, and you basically blow into a tube and see how it changes a gauge inside the instruments. And then there's a series of measurements you can make, and then you plug them into some mathematical formulas, and you use some logic to determine the other values. This is a useful technique when they're trying to figure out what's going on with somebody who's having respiratory problems. These techniques can help you distinguish between pulmonary diseases of the lungs that are obstructive, like if you have bronchitis, inflammation in the bronchi, that's either making them constrict, or you've got fluid, mucus down there because you have an infection, or restrictive type disorders. That's where you have a reduction in your total lung capacity because you've got changes due to fibrosis, conversion of alveoli, little air sacs, over into fibrous connective tissue due to damage to the alveoli. And again, a lot of times that's due to smoking, unfortunately, and then also TB, tuberculosis, an infectious disease that can cause those types of problems as well. Okay, I'm actually going to cut off that video clip there, and because then next we're going to talk about the actual gas exchanges that have to take place between the blood and the lungs, and then between the blood and your tissues, like I'm saying, your blood and your tissues. So we will resume shortly.